Hello, everyone, and welcome to the session on unpacking social and emotional challenges for teens and young adults with X and Y variations. Our presenters today will be Caitlin Middleton, Kate Deere, and Rebecca Wilson. And I don't believe that they can hear me, but I would like to welcome them,
John.
and we're very happy to have them here. And I will pass the session over to the presenters. Thank you, everyone.
Thanks, John. We can hear you here.
Okay, great.
I'm Erin Gordon. I'm one of the AXYS board members, and I'm happy to introduce this morning's session. Thanks to everybody for getting up. We have two great speakers this morning, Dr. Caitlin Middleton and Dr. Kate Deere. Dr. Middleton is a licensed psychologist and is an associate professor of pediatrics at the University of Colorado School of Medicine. She's a practicing psychologist in developmental pediatrics at Children's Hospital Colorado, and she's one of the psychologists on the Extraordinary Kids team. In this role, Dr. Middleton provides evidence-based assessment and consultation to families and children of all ages with X and Y chromosome variations. Her research and clinical interests include the assessment and treatment of autism and co-occurring mental health conditions, sexual and reproductive health in individuals with neurodevelopmental conditions, and neurodivergent gender diverse youth. Dr. Deere obtained her master's degree in clinical psychology in 2008 from the University of Hartford, where she also graduated in 2012 with her Doctor of Psychology. For the past 7 years, Dr. Deere has focused on pediatric neurodevelopmental assessments. In 2024, she joined the section of developmental pediatrics at University of Colorado School of Medicine. She practices at Children's Hospital Colorado, where she completes assessments and conducts therapy with the neurodiverse pediatric population, with an investment in providing compassionate, strength-based, and whole person care. Welcome to both of you. Thank you so much for being here.
All right. Good morning, everyone. So we're going to unpack some social emotional challenges, We don't have any disclosures, although we did use AI to generate some of the images, and that caused a lot of problems with the file being too big because those AI images are huge. So to get started, we are not going to talk a whole lot today about mental health diagnoses. So we're going to move away from diagnosis-specific information and talk more generally about presentations, behaviors, emotions, things that we typically see in our teens with X and Y variations. And so this slide, you've heard probably a lot about these things over the course of the weekend. But in terms of what makes things challenging, there's a lot of complexity to it. Problem solving, attention, anxiety, or fears or worries, slower maturity, which we'll talk about, maybe having some younger interests, adaptive skills or daily living skills. All of these pieces kind of happen together. They don't happen in a vacuum, and they all can increase social emotional challenges. I think we've seen this slide multiple times over the weekend. In terms of mental health diagnoses, multiple mental health diagnoses can occur at the same time. That's probably the most common, followed by anxiety in particular, ADHD, and depression. But why are these diagnoses happening at higher rates? It is very complex. Kids with X and Y variations have a ton of strengths in many of these areas, and also may have challenges in these areas. So for example, if you have poor executive functioning skills, that may make things more confusing when you go into a social situation or you go into a school situation and you're trying to figure out, where am I supposed to be? What do I do when I get there? How do I get to the end of what I'm supposed to do? And all of these pieces can come together to kind of exacerbate but knowledge is power. So just you being here today is powerful in terms of your ability to know what to look for your teen or for yourself. Having, and we're going to talk about a toolbox of strategies for some of these different challenges and resources. And so those pieces are really important, as well as knowing, well, when do I need extra help? When is what I'm doing at home and the support and advocacy that I'm giving my child? When do I need a little bit more and need some professional input? Or when do I go seek therapy or something like that? We'll talk about that. Okay, we've talked about statistics, we've talked about rates and prevalence. We're going to get away from that. We want to talk about real people and what we see in the real world with families that we've worked with and the kids and teens that we've seen. So we're going to go through kind of the main social emotional areas that we see challenges in and talk about strategies. And the first one is language processing.
All right. Hi, folks. So language auditory processing, a huge thing to consider for our kiddos with XY variations. I'm sure you guys are familiar with this, but what we know is kids with XY variations tend to have a relative weakness in verbal skills, especially when compared to stronger visual, spatial, sort of hands-on learning skills. Expressive language skills seem to be more impacted, and there can be difficulties with auditory processing. So how this is going to look in day-to-day interactions is becoming overwhelmed with lots of talking, using big, long words, talking rapidly, quickly, maybe lower volume. Long sentences too tend to be really challenging to process. What is all of this meaning? There can be difficulty with following multi-step directions. So if you're like, okay, hey, can you go grab your backpack? Make sure that your lunchbox and your red folder is in there, and then come back to me and we'll take your meds. What? Which folder? Like, what? Okay. And then we're getting frustrated. We're having these breakdowns and our morning is starting off kind of rough. This also might look like trouble keeping up in conversations. So Caitlin will talk a little bit about processing speed here in a few minutes, but you might hear a kiddo make a statement seconds, minutes after that topic has passed. And you might be able to sort of keep up, but with peers, this might be a little bit more challenging because they're thinking, like, I thought we were done talking about Avengers or what we were doing this weekend, and now we're going back, right? So there can be some social implications there as well. You certainly might see longer pauses before your teen responds. So that's certainly a strategy we're going to talk about in terms of allowing and providing opportunities for pauses. When we go ahead and we mix emotions with language, it's extra challenging. What we see in a lot of the teens we work with XY variations is trouble identifying an emotion. My body feels kind of weird. I don't know why. And then trouble labeling and expressing it. Language is sort of a mediator for emotion regulation, and that language helps us categorize feelings and then, of course, express them to say, I'm feeling kind of worried about school today. I might need a little extra help this morning. Okay. I am sure many of you in this room and online might have had the experience of feeling like their kids or teens are making up stories, or they're like, no, but you told me we were going to get ice cream after school. I know you did. And you're like, did I? Right? I was busy this morning. Maybe I did. I don't know. Or you're thinking you heard about something that happened at school and you're thinking, I know that is not what happened. I talked to your teacher. And it feels really frustrating because it feels like what we hear about from parents is they're lying all the time. They're lying. They're making these things up. A fancy word for this, we call this confabulation. And really what is happening, and when we think about confabulation, is kind of filling in gaps, or it feels like falsifying stories. So for our kids with XY variations, what seems to be likely happening is they're hearing part of what you're saying, okay, related to these auditory processing, language processing issues. So they hear parts. And then, like any of us, we want to fill in the gaps. We want to make sense of what's been happening and what's been going on. So teens might fill in those gaps based on what they want to happen. Okay, own perspective. They might fill in those gaps based on visual memory because that's a strength. And so big picture, that's kind of a neat thing, using an area of strength to compensate for an area that's a little bit harder. And then they might be using some more immature problem solving or coping mechanisms to try to avoid getting in trouble. Okay. So we might think, well, like a 6-year-old would do that. And that's where you need to consider maybe those more slowly developing social and emotional skills and understand it within that lens. So taking all that information together, slowing down, realizing they're not lying, right? They're not intentionally usually trying to kind of pull one over. What they're really trying to do is make sense of gaps in information. Okay. So as I've been talking about the language processing, I've alluded to some strategies. One really important one is use concise statements, short sentences. Okay. Adjust your language level to where you know your child's language is. So lots of our teens will still have information from maybe school testing or outside evaluation. So we've got some, hard data about that, but you interact with your family members on a daily basis. So make sure your language is matching where your child is. Fast talker. I don't know if anybody else is. So anytime I present, I try to be really aware of not speaking too quickly. So pay attention to that. I mentioned creating natural opportunities for pauses. So as you're being cognizant of how quickly you're speaking, pause between sentences. And this can create opportunities for clarification. One caution here, I know I've had this happen many, many times. You ask, did you get what I said? Does that make sense? You're going to hear, yes, good. More likely than not. Okay. So try to create some natural opportunities for clarification that don't kind of like put that spotlight on, I think you didn't understand. So you might kind of wrap up or create summary statements, okay? And say, all right, so I'm walking away from this conversation with 2 bullet points, right? And those main ideas. Be like, is that what you got too? Or what do you think, right? So creating those opportunities to get on the same page. Use visuals. So if I'm talking about a schedule for the week, I'm likely to bring out a calendar, color-coded, whether it be an actual paper calendar or bringing out your phone or computer. So use visuals and then stay focused. I hope I am not the only one in the room that gets off on tangents like so easily. My family always jokes with me that I can make a short story long. So I need to be really careful about that. I'm absolutely somebody that needs to pay attention. So particularly if you are talking about something more involved, more emotionally involved, more complex, keep on topic. This isn't the time to sort of talk about your beach plans and then go off on a tangent about how one time you went to the beach when you were 10 and there was a horseshoe crab shell in the ocean. That did happen to me one time. Oh gosh, irritability. This is such a tough one. We certainly may see grumpy behavior. What I often hear from parents is like, I got a little Sour Patch Kid, right? And kind of a short fuse. This might show up in low frustration tolerance, getting really annoyed with small things, being sort of snappy. whiny, kind of more prone to crying, or just kind of showing those upset behaviors. Could certainly also show up in resistance and refusal. Okay. Nope, not doing that. Lots of I don't knows. Lots of I don't knows. Response or question to ask, what's wrong? What is it? Can I help? Like, fix it. Questions. Might get a lots of I don't know. For kids with XY variations, we might be more likely to also see some shutdown type behaviors as a manifestation of irritability. So going to your room, kind of just like disengaging. I'm just grumpy. I don't know what to do. It might be less vocal, and it might show up in behaviors or withdrawal, which we'll talk about in a minute as well. What do we do? Gosh, sometimes I find that it's really important to remind myself that as challenging as it is to be around somebody that's grumpy, we all know that, right? It's hard to be around somebody you feel like you're walking on eggshells. It's also really hard to be that person and feel that way. We've all had those really grumpy days, and we know it just sort of stinks. So something that's really important, I think, is to just reflect and validate. I know it stinks to feel this way. Okay. Give some space, ride the wave. So this is a concept taken from dialectical behavior therapy related to this idea that we can experience our feelings without judgment, knowing they're going to crest and they will come down. That coming down part is hard to really recognize for our kiddos with XY variations and our teens who can experience more intense emotions. But give space to kind of know this stinks. It will get better. Be mindful of questions and demands. You're going to hear me reference back to language processing a lot. So questions, number one, pull on those language and auditory processing skills that we know are more challenging. And again, this is something I need to remind myself of a lot. Questions are demands. You're putting a demand on somebody else by saying, answer this, tell me this information. It's a demand. And when we're already feeling grumpy, cranky, extra demands isn't exactly what we're wanting or what's going to be most helpful. So be mindful of that. Irritability is often a secondary emotion, right? It's the way teens are showing their anxiety or showing maybe some stress about something that happened in a school or work environment. So it seems natural to want to be like, what's wrong? What are we going to do? Okay. Be mindful of the language and the demand associated with asking questions. Help with problem solving. I think this requires some careful consideration when we get into adolescence and young adulthood. Have challenges. I want to jump in. I want to help. I want to make it better. Especially as kids get older, though, we want to try with an understanding and providing supports that are appropriate for their developmental and medical needs. We want to try to give a little bit more space to teach problem solving so that it can start to become a more independent skill. Okay. We also want to think about how we are wording, how we're offering problem solving help. Seems really natural to be like, do you want help? We can fix this. This is actually not a big deal. Okay. So now your kiddo's like, it is a big deal. And I don't know how to fix it because I don't fully understand the problem or the steps that are required to even start going about solving it. So no, I don't need help. Thank you. Goodbye. So what I would offer is some more non-directive statements in a calmer, quieter moment. I've got some ideas about how to help. Let me know if you want to hear them. Okay. You've put it out there. Give some space for your adolescent to make that choice. Okay. And you can certainly offer that again and make that statement again. And then be proactive, right? So build in activities and routines into day-to-day life that support well-being, whatever that is for your kiddo. So predictable schedules tend to help. Things that your teen likes to do are really important. Kind of maintaining and monitoring mood, planning for things coming in the future that we know might be more challenging and perhaps cause some anxiety or cause some stress or upset that might show up as irritability. So try to plan for those things. And along with that, we also have to remember that like not all situations or problems have a really great solution. Sometimes we're just having a cranky day. I don't know if anyone else I likes the book Alexander and the Terrible, Horrible, No Good, Very Bad Day. But when people ask what's my favorite book, I usually say that. And it's this idea of like, some days are like that, even in Australia. Okay. Some days, because Alexander is going to move to Australia because he's had all these horrible, stressful experiences during the day. But he's like, Australia must be the thing to do. So sort of accept that, embrace that. Some days are like that. Okay, so I mentioned withdrawal a little bit ago. This is something I often pay a lot of attention to because I think withdrawal can take over pretty quickly, and it can often be a manifestation or sort of a symptom of something else going on. And I think we all are fairly familiar with how this looks. Lots of time in their room, lots of time on screens or sleeping, not being involved with family or friends or perhaps activities that they used to regularly participate in. When they're out, we might see more hoodie over the head, sunglasses on, almost as these physical shields of like, hey, I am feeling like I don't want to interact. Strategies. So find the in. What I mean here is meet your teen where they are, engage and connect through preferred activities, find the in. I work with an adolescent female who's been having some increased withdrawal in the context of increased anxiety and some depressed mood. And what her parents did is, I'm not quite sure how. I think there was some incentive for her brother, but they worked with brother to play her favorite video game with her. Okay, so she was still on screens, right? Still on screens, maybe a little more than we would ideally like, but she was engaging with her brother and doing it together. And there was some, we can call it playful sibling banter about who liked it, who was better, who was, making all these mistakes in their game. Spoiler alert, it wasn't her. Right? But it was, I could tell at our next session, leading to some excitement, invigoration, and increased engagement with the family. Okay. Find or plan a daily event or daily activity. This can be really small. Okay. Let's go get a cake pop. That's reinforcing if you like cake pops. Okay. Let's go get something you like. We can go through the drive-through. Kid doesn't even have to get out of the car. Start small, reinforce that. And you might think, do I really need to reinforce like going to get a treat? I would say, yeah. Be like, thanks for coming with me. That was cool. We don't need to make a big deal about it. And then build on those routines. Okay. Check in. So we're talking about adolescents and young adults. We want to maintain trust. We want to follow guidelines as they pertain to consent and whatever legal arrangements may or may not be in place. But I would say with trust and consent and openness, check in with your adolescents, teachers, coaches, folks who may be involved. There's been many situations where by doing that, parents have actually learned about a recent stressor or event that's been really hard for their kids. And it gives us a different context within which to understand their withdrawal and behaviors. Okay, your adolescents are not going to like this. Okay, it didn't come from me. or you can put it on me. We're going to have to probably think about working on sleep and screen hygiene. This is a long game, right? This is hard, but we know that more screen time, is going to be challenging. We want to also meet our adolescents' increased need for sleep and rest. So we want to be very mindful of those medical needs. And we want to work on sleep routines that help them participate in the things that they enjoy and like, and find some accommodations there. Temporarily adjust expectations. So in these times of increased withdrawal, it's probably not the most helpful to hold really hard and fast to some really firm expectations and rules. As caregivers and adults, we all have Costco pizza on the way home from work, and like, that's what it is. Okay, so we all do this for ourselves, and we need to remember to do this for our adolescents as well. Adjust your expectations. Does the room need to be cleaned eventually? Yeah. Does it need to be cleaned today? Maybe not. Okay. I'm going to go back to it. Try to minimize your questions and demands from a language processing perspective. All right, Caitlin's going to talk with us a little bit about big reactions to small problems.
Okay, how many of us have heard big deal, little deal? That language, that terminology. I see nods. Yes, yes. Okay, right. We are all human. And sometimes as humans, we have big reactions, not just our kids, not just our teens. Humans do this, right? And what this really looks like is getting easily frustrated by little things. But this might be a big thing to your kid. This might feel really big to them. And as parents or as adults, we might say, oh, that's no big deal. And that might feel really invalidating. We'll talk about some strategies in a second, but I want to talk a little bit more about what these things look like. So big reactions to small things that we would consider smaller deals. When you see your kid using never and always language, you're never going to let me go to the movies by myself. You're never going to let me fill in the blank. You always tell me fill in the blank. Reactions might appear younger. So maybe at 14, we wouldn't expect stamping feet, yelling, crying, screaming. And that tells you that, something is really feeling stressful and big to your child. Big reactions also often happen when parents try to set limits. This happens throughout life, right? And so we want to try to do a few things. Maybe you've used the words big deal, little deal, and try to do some teaching around that. What do you think? Is this a big deal or a little deal? And if your child says it's a big deal, I would say, yeah, it does feel like a big deal. You're right. It feels like a big deal. You don't have to agree. Okay. One of the biggest things that I use with my own child and I've used with families that I've worked with is really setting the expectation. Parents and kids don't have to agree. So you don't have, by saying, yeah, you're right, that does feel like a big deal. That doesn't mean you agree it is a big deal, but just that validation that you understand that it's feeling that way for your child. The other piece is this idea around measuring feelings and doing some regulation, practicing regulation. Many of you have probably seen the thermometer. Your kids might hate it, and that's okay. You don't have to use a thermometer. You can use numbers. You can just talk about it. You can use gestures. You can use other visuals, emojis. I am not wedded to the thermometer. I use it a lot as a psychologist. But if a kid tells me I hate it, I'm not going to force them to use it. But this idea around measuring feelings, okay, if you're in the red, we're not even going to be talking about whether this is a big deal or a little deal. But maybe if you're in the yellow, maybe if you're kind of in the middle and you're just feeling a little bit frustrated, we can have a conversation about it. But when you're up here, that is not the time to talk about it. We're going to try to do things to get you down to here, and then we can have a conversation about it. And all of these strategies and all of these concepts, we could do like a full day workshop on these things. So we're just trying to give a little bit of a taste of some of the strategies, some of our favorite things that we use with families, with our own kids too, that seem to be effective, that have some evidence behind them. Just wanted to give that plug. Reduce language. Here we go. We come back to reducing language, having short phrases, keeping questions limited, and slowing the pace. So when your child or your teen is up here, think about how you're going to be down here. You're going to use, maybe you're thinking you're also in the red and coming back down for yourself. How are you as a parent going to come back down and be down here when your child is up here? That's the first thing. Slower pace in what you're saying, calmer tone. It doesn't have to sound condescending. It doesn't have to sound childlike to your teen. It can be very matter of fact, but that is all. Slower processing speed. So again, not related to a specific diagnosis necessarily, but kids with X and Y, teens with X and Y variations may have slower processors, may need more time to think through information that's coming at them. And what this might look like is long pauses in thinking and talking, but maybe not letting you know that they're thinking through an answer to something. And so you might find yourself thinking, are they done talking? Do they have more to say? Do they need help? So it's kind of, and teachers may feel like this, or peers may feel like this, or other family members, and that kind of confusion of, should I say something? Should I step in? Should I support? Should I allow time? Another way it might look is taking a long time with some daily tasks, brushing teeth, finding your backpack, getting dressed. Those things may take longer. It's a lot of stuff to process. And if you went to the executive functioning talk yesterday, a lot of this goes into executive functioning skills too. So the other piece, Kate mentioned this with the language processing, you may hear your teen come back to something that was talked about, processed it, and want to comment on it, which is great. But that also may be disorienting in the conversation if you've moved on. So some slower processor strategies that could be helpful might be pre-teaching. So and you all probably do a lot of this, and you might not even know you're doing this. So before you go into a situation, maybe you're going to a birthday party or you're going to a family member's house, saying, okay, Aunt Susie is going to be there and she just got back from a vacation, and you can ask her X, Y, or Z. And so kind of pre-teaching what to expect, maybe some topics to talk about. Processing is much better one-on-one. And that is true for lots of different folks, but having that one-on-one time. So if you know you're going into a big situation, trying to find, what I mean by that is lots of people. Maybe it's going to be noisy. Maybe there's going to be a lot of distractions. Finding that time to step aside for that one-to-one processing. You could even do teaching in the moment, but I would do it one-on-one, having step aside and talk with your teen about it. Fitting those expectations to your teen's processing style. If you know that they need more time, giving them 1 step, 2 steps, and then pause and then wait and then step in. I know it's a lot of reminders, and there's lots of other strategies that you can use so you take yourself out of the equation. I'm sure you heard a lot about those in the executive functioning talk yesterday, visuals and setting reminders and things like that. Checklists, another one that's a really good strategy. The one that I have honestly found the most success with is teaching filler statements. And we sometimes have to do direct teaching with these filler statements where we say, okay, if you don't know the kind of how to respond to your teacher or to someone who you're talking to, say, just give me a sec. I just need a moment. Hold on, let me think. And that buys you some time. And kind of advocate for our kids with school, with other family members to say, hey, when my kid says, give me a second, give them a second, and let them process. Okay. Slower maturity. This slide, you'll see here too, immaturity. I like slower maturity because the maturity comes for our teens with X and Y variations. It's going to come. It just might take longer, and expectations in terms of maturity for our teens. We want to think about where they're at, meeting them where they're at, and not necessarily expecting because of their 14, 15, 16, expecting maturity at that age. It just depends on your individual teen. But what this might look like is preferring to hang out with younger kids or play with younger kids, prefers more kind of interactive gaming or kind of doing something as opposed to talking, maybe missing some social cues, having a hard time with conversations, with back and forth conversations, maybe telling some immature jokes. And this could also, we're going to talk about social safety here in a moment, but this could also make teens more prone to bullying, and also following rather than leading. And a lot of parents, we've heard a lot of parents have concerns about safety with being influenced by other kids or other peers. And this kind of slower maturity does play a role in that. This stuff, the slower maturity, it directly impacts social safety. About social safety, but I'm going to give you a little taste, and then hopefully next year we could do more on social safety. What is social safety? It's a lot of things. This is what I hear parents of teens talk a lot about. Self-advocacy. I'm worried that my teen is not going to ask for help. They're not going to stand up for themselves. Consent. I'm worried that they're going to be taken advantage of. Understanding healthy and unhealthy relationships. Bullying, not just in person, but a lot of it happens online. Internet safety. Interpersonal safety as teens become more independent, and more serious things like abuse prevention. So I encourage you to take a picture of this slide. These books are fantastic in terms of thinking about social safety, consent, social media, internet, talking about body boundaries. So the biggest thing that I talk about with families is teaching skills about social safety, restricting access. So restricting access to social media, to internet, to, just kind of unfiltered access, basically, and then monitoring. We can't restrict completely. We can't say, you can't ever have a phone, or you can't ever have a tablet, or you can't ever go online, because that's not realistic in the world that we live in. So we have to teach some good skills around it, but then we also have to monitor. And I know it's a full-time job. It is a full-time job to monitor internet stuff. And teens are really savvy with finding the workarounds. We also want to identify trusted people to talk about concerns with: school counselor, therapists. If you have a family friend or a neighbor, somebody that that your child can go to if they don't want to go to you to talk about things kind of in this realm. Teaching how to ask for help. Again, this is around skills building and talking about needs. I have friends that are on social media. I really want to connect with them on social media. So can we talk about how to do that? And you can share this with your child. So saying, I know you have friends on social media. So let's talk about what's realistic in our family, what our values are. Role playing different situations. Show your kids the scams that you get in your email. You've won $1,000 from Amazon. You got a text message saying that there's a warrant out for your arrest, right? I just got a call the other day. I think I'm on a lot of lists to be arrested. Show your teens these emails and say, how do you know that this is a scam? What would this tell you? What about this tells you that this is a scam? And do some teaching, use those as teachable moments. Talk about how characters in a book or movie that you're watching together or reading a book together, how are they advocating for themselves? What do they see that this character is doing to stick up for themselves? And then real world practice. Missteps are going to happen. It's totally typical for that to happen in adolescence, but use those as teachable moments to talk through what to do next time when that happens. Any of you familiar with Circle of Friends? Yes? Okay, I see a few nods. Great. This is just one example of a way to teach social safety. You can use this in a lot of different ways. It doesn't have to be this version. There's a lot of different types of visuals online that you can look up. It's called Circle of Friends. And you can talk about, okay, who's in your inner circle? Okay, maybe you, your parents, siblings. Okay, then who's in your close kind of friend circle? And maybe, there's people out here in your kind of most outer circle acquaintances that you want to bring in to your inner circle. Let's talk about how to do that. It doesn't happen one interaction or two interactions. Let's talk about that. You can also use this to talk about what it's okay to share and what type of information is okay to share with people who are in different levels of your circle. And that's a nice teachable skill in terms of boundaries, consent, things like that. What do you think? Yeah. Okay.
We're just doing a time check. So we're going to very quickly bring this all together. And I'm going to talk about a case using a pseudonym, Lewis. He was a 13-year-old with XXY and came in to our evaluation clinic with a diagnosis of ADHD. The evaluation team provided diagnoses of autism spectrum disorder and anxiety. He was referred to me for therapy, and in kind of doing the interview to get us ready for therapy, learned that there was some depressive symptoms going on. So he was experiencing a lot of the things that we've just talked about from an outward perspective. But internally, I want to give a nod to things that might be going on in terms of thought patterns or internal experiences for teens. And the really interesting thing here is that a lot of these thoughts that Lewis was having didn't come up until we asked, right? And he had just done this whole huge evaluation, and some of these concerns didn't really come to surface until we asked the questions. And these are hard questions to ask. He was having a lot of all or nothing thinking. I can't get anything right. I'm so different from everybody. Nobody gets it. And he was also having some thoughts about thinking like, what if I weren't here? What if I were dead? He wasn't having, I think it's important as a psychologist to clarify, he wasn't having any plans. He was just really thinking like, this is hard. right? So he's having a lot of challenges. And through a course of treatment, cognitive behavior therapy, I'm sure you guys have heard so much about this. And anytime I talk about CBT, I always think people are going to be like, oh my gosh, if one person talks about CBT to me again, I'm going to scream. There's a reason we talk about it. It's got a lot of scientific support. But through a course of CBT, Lewis was able to kind of beef up some of his coping and regulation skills to manage some of the anxiety and depression he was experiencing. He no longer had thoughts about wishing he were not here. And I think one really cool thing that happened in treatment through using CBT methods is we were able to chip away a bit at this really ingrained thought of everyone is always looking at me or always talking about me. And a couple of important things here. Lewis had been bullied kind of intermittently throughout the years. There was a particular group of girls. So he had these experiences. So many of his thoughts about like, people are talking about me, people are looking at me, were rooted in these experiences he had had. So it was really important to recognize that. And he did a nice job in many situations of advocating. He was assigned actually to this group of girls for a project, and he appropriately was kind of like, I'll do it by myself. And that was the option that he chose. And I thought that was really neat. But we were also able to chip away at the thought at the thought of, I don't think everyone's always looking at you or always talking about you. And I think that was a really important step for him to gain some of that confidence to go out. He joined some activities. He went on a really big field trip that previously would have been really hard for him. So there's a lot of different components of CBT that we talk about. A couple of the most important that I'll highlight for our teens with XY variations is that psychoeducation piece. We also often do like a really quick thing about, well, like this is what feelings are and this is what they might feel like, da 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 da. It needs to be a little bit more in depth and more concrete, and we need to revisit it. I've worked with a kid over a long time, and recently he came in and his anxiety is so significantly reduced. It's super cool to see. And he was talking about feeling nervous about getting ready to play his video games. I'm like, nervous. And I was like, well, were you worried you weren't going to be able to do it or that they're going to be taken away? I was trying to get at what the nervous feeling was. And as we broke it down, he was excited. He had earned some extra video game time. And he was really jazzed about that. And when you think about anxiety, it's that physiological arousal can be super easily mistaken and kind of overlaps with excitement, nervousness. They all sort of have some similar body feelings. And we had already done a lot of this work. So just remembering we need to revisit it. It's not going backwards. It's revisiting it and continuing to move forward and build on that foundation of what are our feelings feeling like in our bodies? What sort of thoughts and cognitive patterns do different feelings trigger? So that's psychoeducation. We focus a lot on calm your body, calm your mind type of thing. So working on those somatic management skills as a way to help promote active like behavioral coping mechanisms and more balanced thinking patterns. So if we can get our body to a regulated state, Caitlin mentioned if we're in that red heightened zone, that's not the time we're going to try some cognitive work or sit down and process. We're calming the body in those moments. Okay. When our brains get to a better state of regulation, we're able to access the thinking part, the logic part of our brain that can help say, okay, maybe this really isn't such a big deal. Or maybe I can go distract myself or do something else to help regulate. So calm your body, calm your mind. We also want to think about providing opportunities for practice, whether it be through watching videos, going out and trying to do some experiential activities, role playing, practicing in therapy a lot. And if you ever see me in therapy, you will get sent home with homework. And I like to joke about it. And kids are like, seriously? Teens are like, seriously? And I'm like, yeah. So going home with some concrete step-by-step exercises. And oftentimes the other important component of CBT that you'll hear us talk about, and then I will talk about very briefly right now, is exposure, is kind of practicing those difficult things in a supported way, so that you can conquer that anxiety and more actively engage in day-to-day activities. We think a lot about avoidance is a super good short-term coping skill. So that makes me nervous, so I'm not going to do it. I don't feel anxious. Problem solved, right? But in the long term, kind of what's happening is we're reinforcing that anxiety and often increasing kind of avoidant, disengaged type behaviors. So if we practice with the right supports, right team, doing those things that are causing anxiety in a graded way, we can kind of reteach our brain, right? That anxiety will come down, and as we're more regulated, we're replacing that kind of fearful cognitive structure with more balanced thinking patterns and behaviors. So a lot of my homework often involves like, hey, you're feeling nervous about talking to this kiddo in your class that you kind of like, but isn't in your intimate circle of friends, but you kind of want them to be. So let's practice in session a way you can go about initiating with that classmate and talk about some ways that you can do that this week. And then next week, we'll talk about it. Okay. So plug for CBT. There's also a lot of other evidence-based treatment programs that I'll draw from. Sometimes I think for teens and adolescents, we forget about OT and speech. Like we think about it for younger kids and then kind of do some of those episodes of care. And then your child becomes a teen. We don't think about these things as much. And I think they're still really important. All these things are stepping stones for various points of development. So speech language therapy tends to remain an important component of treatment, given some language processing and weaknesses in verbal areas. But also we want to be addressing we want to be addressing how we're communicating in social situations. So pragmatic language. How we're using our verbal communication and our nonverbal communication skills in social situations, really important for our adolescent population. And then our friendly neighborhood OTs, man, they have such great strategies. I work with OTs regularly, and I feel like I learn new things on a weekly basis about strategies. I'm like, oh, that is such a great idea. I never thought about that. So OTs can be really helpful in promoting certainly like sensory and emotion regulation, also adaptive tasks. How are we going to break those down? We get into adolescence and there's suddenly this like spike in demands and complexity. And it's a good time to revisit OT if your adolescent is not already an OT to kind of say, how can we help break down and problem solve some of these adaptive self-care tasks? So our top takeaways, our hope is that there have been a couple little pieces of knowledge imparted throughout our brief talk here, but here are some top things that we want to emphasize. I'm just going to highlight a couple. Create daily routines that support well-being, whether that be participating in a certain event or activity, taking a hot shower in the morning, whatever it is, while also understanding that this process of social emotional growth is a long game. And it's going to shift. Find and build on those strengths. There are so many there. And oftentimes meetings or evaluations are often focused on, what's not going well. And it's really important to say, I want to talk about all these awesome things. Your adolescent needs to hear you say those things. Okay. Start with where your kid is versus where you think they should be or people tell you they should be. There's a lot of shoulds involved in this line of thinking. So try not to should so much and start with where you know your kid is. And trust your parenting, trust your kid. They're so amazing. And I feel so privileged to be able to work with kids with XY variations. And trust in their awesomeness, and know that you guys are doing a wonderful, beautiful job. I think that's often something that kind of gets forgotten too, because we're always talking about, well, try this or try this or try this. We have to pause and be like, we're all doing great things right now. And just by being here certainly shows that. So thank you guys very much for sticking with us for this talk. And we're happy to answer questions.